So I have essentially, let's say, 3 major goals for you today. One is I want you to see the importance of these nutrients. So we're going to walk through several nutrients related to brain health. I want you to see how important they are for you. And secondly, I want you to see how you can get them in your diet. So really, you want to be starting by making sure that your diet is full of these nutrients. I mean, really, truly, you can't eat too much of the nutrients we're going to talk about today. I also want you to see that sometimes in life we don't necessarily eat what we need to, and you may need supplements. And so if you're taking supplements or you think you need supplements, then I want you to be aware of how to read your labels. So chances are you've got some at home, and I want you to be able to turn them around and read what's in them, and I'm going to provide you with a good solution as well if what you read on your labels when you get home is not pleasing for you. So vitamin E is the fat-soluble antioxidant. Vitamin C is the water-soluble one. Interestingly, they work very closely together. The vitamin E is in the cell membranes. It neutralizes the free radicals as they're generated. It also has potent anti-inflammatory. So you heard about oxidation and free radicals and also inflammation. That's kind of what makes things sticky in our arteries and creates clogging and also joint pain and a lot of other issues that can happen. Vitamin C is a little less potent, but interestingly, it actually restores vitamin E to its antioxidant capacity. So they have to be working together. And so how do we get vitamin E? Now, I said diet was really, really important. So thinking about stocking these things at home, thinking about eating them every day, thinking about finding ways to get them into your food and into your family's food. On a daily basis. And when we say whole grains, I don't mean whole wheat. So everybody knows the difference. We want to be using whole grains. We don't want things with processed flour if we can help it.
You probably already answered this. Will this be available to us?
The slides will be available if you do the sign in that Evan's going to have you do. Yes, yes. Any other burning questions? Because you guys look like you're really quiet. This is such a quiet audience. So my background actually includes some additional training in relationships and sexual health, and so I was kind of wondering if everybody showed up today thinking the topic might have been a little more juicy than the brain. But you can read studies that say that people need 3,000 international units of vitamin E if they, for example, have proven clogged arteries or proven heart disease, or they have Alzheimer's disease or things like that. And so this is based on my assessment when I completed my questions with this particular program. It determined that I only needed 11 international units because, of course, I put in there what I'm eating, I put in there my activity level, I put in there my level of health. And so it's going to count on me getting a lot of my vitamin E from dietary sources and also that I probably don't need a whole lot with the way that I've answered those questions.